Hey, everybody, it's David Roberts, and you're listening to the Mara Labs podcast. And today we have Dr. Jesse Myers with us. And Dr. Myers is a graduate of the University of New England with a doctorate in dentistry. He's a member of the American Dental Association, and he's really passionate about how nutrition impacts whole body health. So he's a holistic dentist, but he's actually more than that. He's a whole body. He practices whole body dentistry, and which is actually more than just holistic dentistry. We'll get into that, but he's also considered himself a functional dentist, combining both the best of Eastern and Western medicines. And so, Dr. Myers, thank you so much for joining us today.
Absolutely. I'm really excited to share a conversation with you guys. Fun fact, one of our mutual friends that John and I share, his name is Nolan Gunn. He introduced us and we had dinner a couple of times, and it was all kind of centered around like food is medicine. And
Yeah.
I ended up cooking two meals in particular. One of them, I called it regenerative red curry, and it had a high concentration of turmeric, along with some of our mutual friends over at Polyface Farm, some of their regenerative meat. And then the other one, the recipe is called Zeresh Polo, which is a derivative off of a Persian dish that is really popular over there in Iran. And that had a high concentration of turmeric, berberine, and barberry, along with something called the red gold or saffron. So we shared really good community, and I felt like it was like I was taking a USB and uploading John's mind into mine. So we shared some really good conversations during that time frame.
At dinner,
I can verify that it was exceptionally delicious as well. So
thank you.
Functionally superior.
Well, a dinner with John will do that uploading. So, yeah. But you can't. I mean, I would love to get those recipes to put in the show notes if you're open to sharing them.
Yeah, awesome. Absolutely. I'm doing a lot of more like TikTok and Instagram videos of some of the recipes that I'm doing, and two of those are going to be ones that are coming up. So I'd love to share it.
Well, so you just mentioned turmeric in your recipes. So let's, so just full disclosure, I had a tooth that needed a root canal. And so I was looking around and didn't actually, in holistic dentistry and just alternative health in general, root canals have a bad name, or they're kind of, and probably rightfully so. We can get into root canal some, but What happened was I actually ended up not wanting to be in too much pain from getting my tooth pulled instead of getting root canal. And so I ended up taking 4 of our products, so 4 of our curcumin product, Curculite, and 2 of our Broccolite, ahead of going over there, not knowing, what he was going to suggest, thinking we'll probably get it pulled. So of course he gave me some Novocaine, looked at it, suggested getting it pulled, and then I took 4 more curcumin, 2 more Broccolites after that, so probably about 3 hours later, and then before bed the same. And so when I woke up the next morning after the Novocaine had worn off, I didn't have any pain, I didn't have any swelling, and or bruising. And so it was like I think that may be atypical, but I was pretty much good to go after that. So but yeah, talk to me about your thoughts about curcumin in dentistry in general, outside of the pain element that I just mentioned.
Yeah, absolutely. Well, I mean, just kind of speaking to the pharmacological actions of curcumin in general, and not just in the field of dentistry. We know that it is a potent anti-inflammatory. It has analgesic properties, which essentially are trying to lower people's pain experience. We've seen that it has potent anti-tumorigenic properties, and we could keep on naming off all these other properties about it. Something that I'm really interested in is the antimicrobial action of curcumin. But specifically with our experience, David, I have been trying to figure out a way that I could offer something that is still more natural to be able to help people's pain experience, especially with like tooth extractions. Because I've had so many patients come in over the last year and consistently are saying, "Doc, this is the worst pain I've ever experienced in my life."
Oh, wow.
I've had women who have had multiple kids. They come in with a tooth infection and they're like, "It's worse. It's worse than giving birth." I wouldn't know what that's like, but just
Wow.
just kind of being able to relay some of the information I've seen as a clinician. I've seen grown men cry because of the pain that comes from tooth infections. And the opioid epidemic, we're really trying to dial in. If you are a prescriber of opioids, then we're getting really tight regulation around it. And I've had personal family experiences with opioids, and I try to stay away from it as much as possible. And so, at least in the dental literature, over-the-counter NSAIDs such as ibuprofen, Tylenol are almost just as effective, if not more effective, than opioids at helping this type of dental pain. But I still like to try to optimize what I might be able to use that's not going to have, hepatotoxicity that we see with Tylenol when it's taken in high concentrations, gastric ulcers that would come from overprescription or overingestion of ibuprofen. And recently we've just now discovered that Tylenol, when taken pre-birth, is a teratogen, or a pharmaceutical agent that can cause birth defects.
Oh, wow.
I'm always trying to evaluate the things that I'm prescribing as a doctor. And I see that, at least in my hands, curcumin can potentially take the place of some of these over-the-counter medications that I still think are safe for people if you're taking them in a prescribed manner by a trained physician. But again, I think that that's just one interest that I have. And then maybe we can talk more about how I might be able to use it in the treatment of something that we do commonly, which is treating periodontal disease and gum disease. But those are just some of my interests.
Absolutely. So, John, I remember you describing or mentioning a paper that compared the combo of curcumin and sulforaphane with ibuprofen. Is that ringing a bell?
Not specifically. I can't remember the exact details of that, but we personally in our own experimentation have shown synergy between the two. In lab in vitro tests, so it would make sense that they support each other's biological functions. We haven't started talking about sulforaphane yet, but sulforaphane is the best inducer of this pathway called NRF2, and curcumin is probably the best inhibitor of NF-kappa B. Mm-hmm. And so both do both. Curcumin has some NRF2 induction, and sulforaphane has some NF-kappa B inhibition. And so when taken together, you could see how there's some clear synergy there. And if they're touching on the same pathways that we were just talking about, analgesia as well as inflammation, that would kind of be right in the center of a lot of the discomfort that people would have relating to dental health and more acute operations. I guess that's what you call them, operations, procedures. Probably better.
Yeah.
Terminology is not so great.
That's fine.
Yeah. So I do want to talk about the disease aspect and curcumin, but what uh, what my experience with taking the combo Curculite broccoli and not really
Hmm.
having any side effects was is that surprising to you, Dr. Meyer? Is that
Yeah, I
something that you were expecting, or if you take if you have folks taking Tylenol and ibuprofen and are fine like that the next day? Or what's
well,
been your experience? I just don't know.
the a lot of times just taking the tooth out can help people get rid of that pain that they're experiencing because it takes care of the bacterial infection. Um, and it's going to depend on somebody's how they're going to process any type of drugs in general. But a lot of times people will experience post-operative pain. Like that's very common. Um, and just remembering the tooth that I extracted for you, David, it had some pretty hefty roots in there.
Yeah.
and and so I was really curious to see how your all's products would end up being able to affect your pain experience. Because really, a lot of times when I'm taking out teeth, it's either because the connective tissue around it has just been degraded and a tooth is just kind of like wiggling. Um, and that wasn't the case for you. You had really healthy bone that was holding those roots in. So in a situation like that, um, there can definitely be more pain experienced. And, I know that you are a very educated man and you know what you're talking about with regards to these compounds. So I don't think that is just a placebo effect.
Yeah. What about swelling? I mean, I've, with people who get their molars removed,
Hmm.
it's you get the, people I've, seen people's face really swollen.
Yeah,
Is that typical as well with a tooth removal, the swelling aspect?
it can be. Yeah, I've seen people sometimes. There's a whole bunch of reasons why there might be some swelling afterwards, but um, a lot of times I'll have a week or 2 week follow up, and people are still having some swelling in the area. So
Oh, wow. Okay.
yeah, now a lot of those people are immunocompromised and have poor wound healing in general. But yeah, swelling is definitely a common side effect that will happen after taking a tooth out.
And one thing that, again, I want to cover a lot of things, but
Sure.
so when we talked, I
Hmm.
was a little surprised that you actually contemplated the root canal, given sort of the its sort of villainous in the
Hmm.
holistic health, and just what's been your experience? Have you seen what have you seen as far as root canals gone that have festered
Hmm.
and have different things like the cavitation lesions, stuff like
Hmm.
that. What's been your experience? What have you seen? And then also what have you seen on the positive side? But I want to hear both.
Yeah, absolutely. It's an extremely nuanced conversation, um,
Okay.
and there's truth on both sides of the spectrum. I like to try to fall somewhere in the middle. With the latest and newest scientific advances, I really think that the options that I was offering to you, if you wanted to pursue that route, would still be a good option. The the thing with root canals, especially historically speaking, we have not been able to clean out canals adequately. There isn't
Yeah.
proper disinfection, and to get a really successful endodontic treatment, which is a root canal, you have to have good isolation, you have to have good instrumentation, and you have to have good disinfection. Um, and a lot of times we just don't see that with a lot of root canals, especially with general practitioners. Um,
Yeah.
So specialists or endodontists are I feel like they are the providers that are really driving a lot of the literature around root canals. And in the dental literature, I see that root canals long term can last for 10 years for people that the practitioners are meticulous and they're masters of what they're doing. Now, with that said, there's still a possibility that further down the line, that root canal is going to end up failing. It's reinfections are common, and so I kind of like to think of it this way. It's not really black and white because for me, like let's say that I knocked out this front tooth and I had trauma to it and ended up dying on me. Because I love the look of my natural smile, and the only reason that I would need to address the infection that would happen in that tooth is because of the trauma. I'm going to elect to go with the latest types of advances that we have with root canals for one of my front teeth, because I really think that as a dental provider, what God has given you is best. And anytime that I have to manipulate that, I've already set that tooth up for failure. So I would rather have, in a situation where it's in the front, I would want one of these new techniques. And that technique for people, if you're curious, is called photoacoustic streaming. And it uses lasers in order to sterilize the canals, which I believe, estimating it, don't quote me on this, but I think if you put together all of the little channels that are running down the length of the root, so if this was the pulp and the canal, you have all of these little channels that are called dental tubules that are, I think, estimated to be 100,000 miles of road if you put all of those little tubules together. So it's really difficult to be able to get into those tiny canals. And this newer technique that uses the photoacoustic streaming and the lasers, it's minimally invasive. You don't have to take as much instrumentation to those root canals. So, I mean, I understand. Another thing to think about too is if you're an immunocompromised individual, let's say you have type 2 diabetes or you have metabolic syndrome, your chances of that root canal being a successful treatment are, I think the rate of needing to retreat an initial root canal goes up by 30%. So,
Okay.
So for me as a healthy individual, something like that happened to me, I'm going to go with the latest scientific advances, knowing that it still might fail further down the line. But that would be something that I'm following up with a good provider to always assess the health of that treatment.
Yeah.
I had a pretty interesting experience. I wasn't even aware of this problem in that area. I had cracked a tooth and went to get a cap put on it, and they put the cap on the wrong tooth.
Oh,
and so
the
the tooth that was actually injured, I think they just assessed which tooth was the one that was painful incorrectly. So maybe they both had a crack or whatnot, but the tooth that they didn't fix went on to get infected inside, and that became a whole fiasco. But because of that, I had the opportunity to sit down on some do you say endodontist?
Endodontist. Yep.
Endodontist, where they were doing a PhD thesis, and I was invited on their committee. And now there are there are instrumentations in the advanced in that field, easier to say, that they assess using skin galvanic response. So they know what tooth is the injured one. They can do cold and they can do heat and percussive and be sure that which tooth is the correct one. So it's really neat to see how advanced this field is getting. So I wasn't aware that the instrumentation to actually do the procedure was advancing so fast. But this was at Harvard and it was very impressive.
Oh yeah, I'm sure, and that's I actually had first heard about this option through a holistic dentist over in California. He has a blog, and he had touched on a lot of the, I guess, more like radical thoughts around root canals, and again, there's a lot of validity to the concerns around root canals. I mean, if you are having a failed root canal and there is fastidious bacteria that's still in those canals, they are inducing endotoxemia throughout the rest of the body. And low grade endotoxemia that's coming from these fastidious bacteria in the canals, they have nowhere else to go. So they're just forming an abscess at the end and growing and continuing to induce systemic inflammation. And so it's both sides of the spectrum have a lot of validity to it. But, you know, in a lot of things with science and a lot of things that we're always learning and we're always advancing. So some of the things that we've done in dentistry, when I look back on some of the historical perspective on it, it is pretty archaic. It's, you know, as things are advancing, we're able to improve upon things that we've done in the past.
Yeah, that's great. Yeah, and it's encouraging to hear that the science of dentistry is how much it's improving. I remember when I was I have a background in biomedical engineering, and so I was at Duke, and one of my professors, an MD PhD, made the comment. He said, this was in early 90s, dentists are like the guys who are on the streets putting cement and asphalt and filling the holes.
Yep.
I'm like, wow, that's not generous, but that was his. I mean, he was like very opinionated, but it sounds like that things have progressed nicely, and so you know, I want to talk some about. I mean, one of John's heroes and coming and I guess because of my friendship with John and hearing so much about Weston A. Price, has become one of my heroes. But I want to hear, you know, who your heroes are. But let's talk first also about going back to the previous topic of curcumin and in a disease, because you have some thoughts that I want to unpack there.
Sure. Well, I really think that the best starting point is to understand what gum disease and gingivitis is. So this is something that is widely experienced globally, but specifically here in the United States. Around 80% of Americans have gingivitis, and the numbers are probably actually more than that. In dental school, we had heard that around 90% of individuals have gingivitis. And so this is red, bleeding, swollen gums that are an inflammatory response right there. So if you are somebody that doesn't floss regularly and you go in and floss and you find that your gums are bleeding, that can be a sign of gingivitis or some aspect of gum disease. And if that isn't addressed early on, it progresses to the chronic form, which is periodontal disease. And so I will just refer to both of those as gum diseases. But individuals over the age of 30, around 50% of Americans have periodontal disease, and some of it is severe forms of periodontal disease where it's one of the leading causes of tooth loss. And what we see with periodontal disease is that it is involved systemically with all of these other health conditions. So we have really good mechanistic understanding now that periodontal disease and gum diseases cause Alzheimer's disease, is related to diabetes. It is now being implicated as the initiator in IBS, IBD, and it's now an independent risk factor for major adverse cardiovascular events. And so periodontists or specialists in the field of dentistry have understood the systemic links to oral health to the rest of the body for a while. And it's now starting to become more apparent in the research just how important oral health is and good dental health is for the rest of the body. And so there's this amazing study that was just published in, I believe, 2019 in Scientific Advances, where they found in patients that had died of Alzheimer's disease, they found the presence of this bacteria that's a key player in periodontal disease called Porphyromonas gingivalis. And Porphyromonas gingivalis is notorious for eliciting endotoxemia in all of these distant organs. And in this study, after they had found the presence of this bacteria in the brains of Alzheimer's disease patients, they found probable patients that had cognitive impairment, and they found the presence of P. gingivalis in their cerebral spinal fluid. And after that, they ended up infecting mice orally with P. gingivalis, and they saw through immunohistological studies that the presence of P. gingivalis was in the brains of the mice, and it caused the aggregation of amyloid beta plaques. And this is really important because the prevailing dogma around Alzheimer's disease is that it is the aggregation of these misfolded proteins in the amyloid beta plaques. And now that that hypothesis is coming under scrutiny, there's another really good article in Scientific Advances that is touching on how this whole hypothesis of the amyloid beta plaque causing the neurodegenerative process may be based on fraudulent images. And so it's really great to see that we're finding out more about this neurodegenerative process and how the mouth is linked to the brain. But what was interesting is that these researchers concluded that the amyloid plaques may actually be an antimicrobial response to the presence of P. gingivalis in the brain. And to me, this makes sense because if you look at what P. gingivalis is, they are anaerobic gram-negative bacteria that have a extremely pathogenic outer membrane called lipopolysaccharide. And the presence of lipopolysaccharide in the blood elicits a hypersensitive reaction by the immune system. And based off of this study, there's a new study that came out that showed the underlying mechanism of how this happens. And there's another portion on the outside membrane of this bacteria, and they call it gingipanes. So gingipanes are these enzymes or these proteases that will break down tight junction proteins anywhere, but specifically in the endothelial lining of the cardiovascular system. And what they showed is that, so the presence of P. gingivalis, the lipopolysaccharide, and the gingipanes of this bacteria together can break down the tight junction proteins in the blood-brain barrier and get into the brain and start causing the neurodegenerative process. And this is really important because gingivitis, periodontal disease, these things are all reversible and they're preventable. And we know that neurodegenerative impairment is not going to happen until decades later. And so these things can be prevented here and now. And when I look at some of the recent research that's coming about with curcumin's capacity to be able to actually attack specifically P. gingivalis, this is really promising. So there's this new study that was just released this last month that was a meta-analysis, which is in the hierarchy of evidence-based medicine. Meta-analyses are kind of the top of the chain, and they're really important because we can look at all of the available studies that are addressing a certain question in the research. And so this meta-analysis evaluated the effect of curcumin on periodontal disease in randomized controlled trials. And they were able to compile 18 randomized controlled trials that were done in humans for comparing the adjunctive use of curcumin along with something we call scaling and root planing versus just scaling and root planing alone. And they concluded that curcumin had more beneficial effects in combination with scaling and root planing for addressing periodontal disease. And part of that was that it significantly reduced some indices that we would look for as providers and also in the research. So some of that was gingival index, which is a marker of inflammation in the blood. And it also significantly reduces these, we call them the red complex and the orange complex bacteria that are predominantly found in gum diseases. And it significantly reduces all of these bacteria. So that is really good evidence. And that's published in Frontiers of Pharmacology. That's a pretty high impact journal. And so this is mainstream. This is not, it's not alternative in the sense of, having to do everything DIY. This is evidence-based medicine. So I am really excited to be able to stand on firm scientific evidence that curcumin can be used in this manner. And I know that you all would be able to speak more on the possibility of it being able to help out with neurodegenerative diseases. And John, I remember when we were talking about how things like Parkinson's disease and Alzheimer's disease begins in the gut, you had talked about exactly how curcumin can stop this process of misfolding proteins that I think would be great for you to bring up.
Yeah, that that process is really interesting, and if you put all the papers together, you might come to the conclusion that the misfolded proteins start in your gut, and then these misfolded proteins travel back up the nerves. The longest nerves in your body will go from your gut and the whole way up to back to your brain. And the misfolded proteins have some interesting properties to it, where they can actually act like a prion. So I'm not sure if people understand sort of prion disease. That was a really controversial subject when I was getting my PhD, and we had people, come and give lectures on it, where they were sort of booed off the stage because people couldn't believe that it really happened. Is a protein can act like a virus, and so this protein that has probably a normal function in the body, when it's misfolded, tends to go and interact with another protein and misfold that protein, and it's sort of a chain reaction. And a lot of the proteins that have prion characteristics are able to travel between cells also, and so they're able to. They have this property where the original one was a fruit fly protein called Antennapedia, but it has cell penetrating capabilities. So it's even able to travel between cells like a virus. And that was the whole controversy was you could take these preps from one cell that had the prion-like characteristics, and you could digest, the lipid. You can digest all the, add a small amount of detergent, and you can digest the DNA, RNA, and it still was able to infect and act like a virus. And so everyone just assumed it was bad methodology, that some was getting through, things like that.
Was that prion the mad cow when you were going through?
Yeah, the person who ended up getting the Nobel Prize for it, I forget his name, but there was sort of an ongoing funny conversation that happens is if you go to my alma mater and give a talk and you're drummed off stage, you're primed for a Nobel Prize, because that's happened a number of times.
That's good to know.
Your research is respectful enough to get you there, and the old guard is still distrustful of something that novel and new. It was really fun, and I really, as you were talking, what really sparked my interest was, even if it's true that the gut microbiome there are experiments showing you can induce this, and it can retroactively go up to your brain and cause brain dysfunction. That might be true, but as you were speaking, the source of the gut inflammation could have started from the mouth in the first place.
Yeah, well,
which is the first egg and chicken, and both probably are dysfunctional together, right?
Absolutely. So, kind of going back to what you had mentioned earlier, David, a shared hero that John and I have is Weston Price, and truly Weston Price's work is foundational. His book, Nutrition and Physical Degeneration, was published in I believe it was 1939, and he really unpacked some amazing research. And some of the language that he uses is outdated in today's day and age, and that definitely I could see during that time frame that some of the discoveries that he made and some of the conclusions that he made could have been pretty radical. But with modern day nutritional science, it's basically validating pretty much all of his findings. And he was very meticulous. He had really good scientific methodology, and he actually was one of the founding members of the research arm of the American Dental Association. And when you look at the images of the indigenous peoples, just robust physical health and their jaw development and the immaculate smiles that they had, like some of the photos that I see, they have better teeth than I do. And so currently I'm actually undergoing clear aligner treatment to kind of address some of my bite issues that I have. And some of the photos that you see is these children have these straight smiles that I would hope to achieve for an end goal of orthodontic treatment. And they had, by today's standards, poor oral hygiene habits. They didn't have toothbrushes. They didn't have floss, which I'm still a very big fan of doing. But they had immaculate dental health, but it wasn't just dental health. It was it was whole body health. And the diets that were not similar across all of the different indigenous tribes that he had studied. They had protection with their traditional diets that were high in fat soluble vitamins, and those fat soluble vitamins A, D, E, and K. And he had called vitamin K, I think it was the X factor at that time. He didn't know what vitamin that was at the time. But it's just amazing how food truly protects our well-being and our existence. And as soon as the introduction of the modern diet, or the standard American diet, was introduced to some of these indigenous people, within one generation, you see that they started to have skeletal malformations. The rates of tooth decay increased drastically within one generation. And you start to see that the children that started to eat these refined white flours, these packaged foods that had excessive added sugars, that their teeth started to get out of alignment, and they shifted towards mouth breathing instead of nasal breathing. So for me, I really, he's foundational for what I want to practice as a dentist, which is whole body dentistry. He really was the pioneer on that front. And modern day science is showing that his findings were solid, and kind of where I feel like he didn't have as much of an understanding, because we're just now gaining this information, is the science of the microbiome. And you don't really see until maybe within the last decade any type of microbiome science, where we're taking a look at the comprehensive, complex relationships that all of the trillions of microorganisms that are living inside of us are doing for our overall health. We used to study bacteria in isolation. We'd grow them in petri dishes, which this is still a good way of trying to find aspects about some sort of disease is culturing, but we have to be able to look at the whole picture. And so microbiome science is starting to get integrated into the dental field. And my perspective is that I see people more than their family physicians. I'll see them at least 2 times a year. And I have a unique opportunity to peek and peer inside somebody's internal health. And the mouth is the perfect mirror and reflector of what is happening internally inside someone's body. And it's also one of the most accessible areas to be able to take a look at the microbiome. And going back to gum diseases, gum disease is microbiome dysbiosis. It is an imbalance in the ecosystem that is inside of us. And when you think about it from that perspective, it makes sense that the digestive system starts right here. And anything that you are exposing this part of the internal environment is going to go downstream. We end up producing a liter of saliva every day, and we're constantly swallowing it. And so that's one way that these periodontal pathogens can start to initiate the inflammatory response that we're starting to see in the research, that P. gingivalis actually can elicit the ulcerative colitis response in inflammatory bowel diseases. And there's another bacteria that we find in gum disease called Fusobacterium nucleatum. And there's really good research that shows that F-nucleatum causes gastrointestinal cancer, which gastrointestinal cancer is one of the top 3 leading causes of all cancers globally. So now that we have the ability to sequence the entirety of the microbiome in a more accessible way, the company that I am working with, they have a pretty amazing story of somebody who didn't even know that they had gastrointestinal cancer. They were just interested in taking a look at what their oral microbiome was like. And they found a high abundance of F-nucleatum in this person's mouth. And they ended up referring this patient over to get a colonoscopy. And this patient ended up having 3 adenomas removed, all through
Wow.
microbiome testing.
Wow. So you've mentioned 2 different bacteria that you don't want to have. What are some ones that you want to look for if you get your oral microbiome tested? What are some good ones?
Well, I think that's a really good question, and I don't think I completely know the answer.
That's okay.
Yeah, that's fine, because we're really learning more about what like a core oral microbiome looks like.
Yeah.
This is what I think. I think that it isn't necessarily that the presence of these bacteria are bad, because when you look at dental literature, especially when we've tried to treat periodontal disease, we have tried to eradicate the presence of these bacteria. So that comes with doing scaling and root planing, and then antibiotic prescription. And you will still see that people can still come back with remission of periodontal disease. It's really hard to eradicate the full presence of these bacteria. I really think that it just has to do with the environment and how the bacteria are responding to certain environmental stimulus. So definitely something that I can stand on is that diversity, biodiversity, and the abundance of bacteria is much higher in healthy individuals than people that have all these chronic diseases.
And the diversity aspect, that's the same as your gut microbiome. You're looking for the diversity. My son actually did his science fair project looking at how quickly the diversity shifts, and found that within if you change your diet, either for the good or for the worse, within 3 days it can shift like hugely. And so correct me if I'm wrong, John, but I remember a conversation where you said Weston A. Price did a study on kids in Philly where they were just kind of eating refined stuff, and then he gave them salads or something like that, and that changed their what we now call the oral microbiome. Is that ringing a bell?
Yeah, his sort of practical aspect to his book. I forget where his clinic was, Cleveland or
I believe it was Cleveland. Yeah.
And so he had some inner city kids that had very clear dental disease and problems. And I think a lot of people at the time didn't think that was reversible. So they, if you had the money, you would fill the cavities in and be on your way. But he provided 1 meal a day to these kids, and it was kind of what you would imagine a healthy stew, which reminds me of the stews that Jesse served when we had dinner. We had really good forms of meat and amazing broth as a base for it. And so these kids just had 1 meal a day, would stop by, and a lot of the dental caries reversed. And I think a lot of people didn't know that was even possible at the time. So it was his own practical experiment to try and use the information he gathered from going around the world. And so he made sure that they had a really good, solid meal, one meal a day, and also provided what he's kind of known for is the high vitamin butter oil mixed with cod liver oil. And so that combination was able to, in pretty short time period, show clear benefit to these kids. And I don't think he even hinted at what the mechanism was at all. But I would guess that, just from what Jesse was saying, that the two big ones that are seem to be in the middle of everything is tight junctions. So
Hmm.
Maybe people don't know this about tight junctions, but NRF2, this pathway that we're talking about, seems to be the master regulator of tight junctions. And then the NF kappa B is the inflammatory response. So that sort of 1-2 punch that happens between those two. You have to have a breakdown of the tissue integrity in order for these endotoxins that Jesse was talking about to get out. And then also, I kind of like the analogy of when that's all disrupted, you have this inflammation, but there's no point source for the infection. And so your immune system just kind of is sending soldiers out everywhere. And I like the thought of just like Yosemite Sam, the cartoon where it seems like he's just a real nervous guy. So if your immune system is like Yosemite Sam, you see any little thing, taps you on your shoulder or makes a noise behind you, and then you just start shooting guns everywhere. And your immune system can be like that. It's made to kill things. But if you have your immune system just shooting everywhere, killing cells right and left, you can literally associate that with virtually every disease. So
Yeah,
when I think about
absolutely.
if you're trying to correct things, the base for sure is good food, because that's been proven to be the base. That's how
Yep,
you're feeding your microbiome. But
absolutely.
the sort of tissue integrity aspect of that, you can also get at with some of these supplements that go back to the beginning of man. I mean, curcumin's been around, berbeриne's been around forever, and the cruciferous vegetables are sort of that source of the NRF2 induction. So I
Yeah.
think in terms of just practical application of it, you take the notion of Weston Price where he says, get rid of the devitalized foods of commerce. I love that term. And then replace it with traditional foods, where we generally talk about it as cuisine. So a society that has a food system together that's able to produce, viable, healthy offspring, would be considered a cuisine. Pick your cuisine that you like, find the origins of it, and the equivalent sources of the food to get it. So get rid of the bad, add the good, and then when you can, you can speed it up a little bit by pushing and pulling on some of these metabolic pathways that have been shown in many papers to be beneficial. So NRF2 induction and NF kappa B inhibition
Yeah, absolutely.
are good ideas. And we can talk about what would be beyond that as well, like the rampant higher histamine that seems to be associated with so many disease states. That's a mast cell destabilization that happens. But you can kind of go everywhere to root causes here, and I think we're just dancing right in the middle of this. We don't normally talk about dentistry and oral health, but it's clear that the same pathologies and the same pathways are right exactly in the middle of that.
Yeah,
And you have
absolutely.
this great opportunity to push people back in the right direction. So just extremely excited that we can send people that we know that are struggling, that need that care, and you're not going to make things worse, and I feel like finding that local community that we started out with is so important, and
Hmm.
there's going to be more people joining that community too. There's a really
Absolutely.
great system of local growers of CSAs that are growing composted food that are a big part of that, and then growing animals in traditional ways where their microbiomes are in good shape, so that they produce food that is supportive of our health. And so I love
Absolutely.
that insight to from one particular point of view, that I didn't hear a single piece of information that sort of rubbed me wrong, that we're completely in synergy here, that
Yeah.
all the things that we're
Absolutely.
pushing sound exactly right.
Yeah. And that's kind of where I view myself, not really more as like a strictly holistic practitioner. I really just view that what I'm trying to accomplish by the type of dentistry that I want to practice is just it's evidence-based medicine at its best, and it's being applied to a lot of these traditional practices that we've seen in things like traditional Chinese medicine, Ayurvedic medicine, and we're placing scientific rigor on the claims that have been made on these traditional practices. And if I might add, so uh, you had touched on how all of these inflammatory pathways are pretty much upregulated in a lot of these different chronic diseases. But we see in periodontal disease specifically that the activation of nuclear factor kappa beta will, cause the genetic expression of all of these pro-inflammatory cytokines like interleukin 1 beta, interleukin 6, tumor necrosis factor alpha. And we also see that a overall marker of all inflammation, high sensitivity C-reactive protein is high in people with periodontal disease. And what's interesting is that there's this really awesome study that I love quoting. It's actually published in the Journal of Periodontology, and it was published in 2009. And it's one of the top 10 trending journals or articles in this journal. And the title is called "The Impact of the Stone Age Diet on Gingival Conditions in the Absence of Oral Hygiene." So basically, they took a small population of people and they ended up for a month trying to induce gingivitis, cavities, and periodontal disease by taking floss, taking toothbrush and toothpaste away from them, and putting them out into almost kind of like a Survivor or the TV show Alone type of situation. And they measured the periodontal health and the microbiome of these individuals who they were trying to induce periodontal disease in. And what they actually found is that no cavities, no periodontal disease or gingivitis happened in the course of the month that they were placed in like a hunter-gatherer type of lifestyle. And notable things that they saw is that the microbiome became much more diverse, and it also increased compared to when they started the study. And another thing that they had found, so something that if you're coming in regularly for your dental checkups, something we do is we're always using this small little instrument that is it's like a ruler, and we're measuring the probing depths of how far down we can get that probe into the gums. So anything that's underneath 3 millimeters is typically indicative of health. Anything above that, we start becoming suspicious of gingivitis or periodontal disease. They actually found that the probing depths in these people ended up improving without flossing and brushing their teeth. And so these researchers concluded that oral diseases like cavities, gingivitis, and gum disease do not happen in the absence of refined carbohydrates and processed foods. And this makes sense to me when you start to look at modern nutritional studies that are looking at dental health and finding out that it really just depends on the types of things that you're putting into your body that is causing all of these essentially autoimmune attacks against these microbes. So it really has to do with the types of things that we're putting internally inside of us in the practices that we're living by.
And Jesse, you were mentioning the mouth being sort of a window into your health, and I know, like when kind of I know like Eastern, like Chinese practitioners, they look at the tongue first thing.
Mm-hmm.
As what's
Yep.
your sense of that, and why do they look at the tongue as sort
Yeah,
of
well,
they're looking at it as a window?
I need to learn more about it myself. I'm actually going to be looking at like some continuing education courses that are looking into traditional Chinese medicine, tongue diagnostics. But from a historical perspective with traditional Chinese medicine, they're physicians over there. So not dentists, but they're physicians always look at the tongue for the health of the patient that they're treating. And they believe that there are certain portions of the tongue that are connecting to specific organs, and any difference in like color, texture, coating, and things like that are indicative of imbalances in the body. And so I definitely utilize a lot of that perspective from what I see with the tongue. So I'm always looking at the tongue whenever I'm doing an exam. And a lot of people don't realize this, but I see microbiome dysbiosis on a daily basis. And I can tell a lot of that from the tongue. And
Is it coated or something?
So there's for a lot of people that have microbiome dysbiosis, I'll see a heavy coating on the tongue. And now that I've got a higher resolution with microbiome testing, I can actually tell what the makeup of that environment is. But I use a specific adjunctive tool that helps me to look at the fluorescent tags of what microorganisms are inside somebody. So somebody that has a candida overgrowth, I will see that their tongue will light up bright orange, and it's a heavy coating on the tongue. I can also see that somebody is low in B vitamins, or also low in iron and micronutrients like zinc and things like that. A lot of things that will happen, especially in women. You'll see these inflammatory processes on the tongue. They're called glossitis, and there's many different types of glossitis, but a lot of it can be linked back down to micronutrient deficiencies in these vitamins. So there's a lot that I can tell, and I'm learning more about it as I'm becoming more skilled as a clinician. But there's a lot that you can tell just from looking at the tongue. And I know in traditional Chinese medicine, they refer to the color of the tongue to be like the qi. I think I said that right.
Yeah.
Which is like the life force of the person. And so with some of this glossitis that I'm seeing clinically, again, you get these vitamins by eating the types of nutrients that are providing these nutrients. And this is controversial, especially in the nutritional space, but I really think that the best source of these foods is coming from grass-fed beef and red meat sources. Yeah. Another thing that's really interesting too, is there are these new pathways that we're learning of how the oral microbiome can actually help to remineralize our teeth. So this is it's really interesting when you study nature. Nature always has repeating patterns. There's a scientist by the name of Benoit Mandelbrot, and he recognized that these repeating patterns, you can actually apply mathematical algorithms to these patterns, and it's called the Fibonacci sequence. And when you run it in a computer simulation, it comes up with these infinite repeating patterns, and they're called fractals. So a fractal image of something I see in nature is similar to how plants have this symbiotic relationship with nitrogen fixing bacteria. So the soil microbiome has these nitrogen fixing bacteria that will help to help the root systems in the plant be healthy and grow. And similar to the root systems of plants getting this nitrogen from the soil microbiome, the oral microbiome has these nitrogen metabolizing bacteria that are important for our fractal root systems in the cardiovascular system. And one of the primary things that the oral microbiome provides for us is that the primary place that we are making nitric oxide, which is this important signaling molecule in the body that helps to lower our blood pressure, it helps to deliver oxygen throughout the body, and it helps to signal for our immune system to be able to function properly. It's primarily made right here in the mouth. And it's so the oral microbiome will take nitrogen compounds like nitrates that you would get in dark leafy green vegetables. You get them from beets. And then there's another pathway that's called the arginine deaminase system, where the amino acid arginine, which is a nitrogen amino acid, can actually be used to make alkali products, where the oral bacteria will take out this arginine and make alkali products to balance out the pH in the mouth and then help to remineralize teeth. So it's really cool for me to be able to talk about this stuff because I'm such a nerd when it comes to this. But it's just amazing, just the type of complexity that we see in the human body and how irreducibly complex it is, and how everything's so interconnected to our well-being. But those are just some things that I'm seeing with regards to the oral microbiome.
I mean, that's one takeaway I'm coming from with our conversation is the interconnectedness, and we've talked about brain, we've talked about, of course, mouth, gut, systemic. I mean, it's pretty interesting, and it's actually, if you think about it, it's actually makes a lot of sense because kind of how our traditional medical system has bifurcated or just separated the systems in order to understand them better, but really they're all functionally coupled. We're a whole beings, and so it does make sense that there's connection. I know our time's wrapping up, but I did want to ask. We were talking about the tongue,
Sure.
and so you had a look at my tongue.
Yep.
I'm a little concerned, but I'm going to go for it. Do you remember what my tongue looked like? Was it healthy or moderate?
From what I was seeing, it looks pretty healthy.
Great.
Yeah, but I'll be honest. I'll need to do a full exam.
Okay.
Yeah.
Well, that's fine. Just first impressions.
So when you come in, we'll take a look at that.
All right. Awesome. And then we haven't really mentioned one of the biggies in modern oral health care is fluoride.
Hmm.
And uh, where do you stand on fluoride? Just very
Well, we
curious.
might need to have a whole nother podcast on this topic, because I have been following this topic very closely since 2018. And I have tried to remain as unbiased as I can on this topic. And it's coming to a boiling point for me where I feel that as a clinician, from an ethical and moral standpoint, I have to start speaking the truth. And a lot of people don't understand this, but just speaking on the topic of water fluoridation, not necessarily just fluoride, but water fluoridation. Water fluoridation is actually in the federal court system, and the EPA is being sued by these nonprofit organizations, and one of them is the Anti-Fluoride Network. And the trial first kind of came about in 2016, where these nonprofit organizations were trying to sue the EPA and get them to reevaluate this public health issue. And the EPA originally ended up denying it, and the judge ended up kind of recognizing that this was happening, and they brought it all the way up to the federal court system in, I believe it's San Francisco. And in 2020, they had a trial on water fluoridation. And when you take a look at the available evidence that the plaintiffs are bringing to the table, some of the expert witnesses that they have brought into this trial, they're some of the world's leading toxicologists, and some of them are adjunct professors at Harvard T. Chan's public health school. And they are NIH-funded scientists that have established neurotoxins for mercury, lead, arsenic. So they're world-renowned toxicologists, and they are finding that water fluoridation and the concentrations that we're seeing here in the United States are causing neurotoxic effects for prenatal exposure to water fluoridation at 0.7 parts per million, which is what we concentrate our municipal water sources here in the United States. And this is extremely concerning because not only is it on par with lead and mercury, we're actually seeing IQ point reductions that are even more exaggerated than some of these other established neurotoxins. And the dental field sorry, go ahead.
So basically fluoride is a neurotoxin.
Yeah.
Okay.
Yep. It is a neurotoxin.
Yeah, we should.
And
let's do that follow up. I'm super interested in that. I have to get running now. But my chemistry professor in college is the guy who started Fluoride Action Network.
Really?
So I've been hearing about it since
interesting
1988.
Okay.
Super interesting.
Last question. What should you look for in your toothpaste? What's the top thing you should look for? And what toothpaste do you recommend?
Top thing is you definitely want some sort of remineralizing agent. So I'm a big fan of hydroxyapatite. So that is the building block of what our teeth is made out of. So the enamel is organized in this mineral matrix called hydroxyapatite. So that's something that I'm looking at because it's showing that it's just as effective, if not more effective, than fluoride at remineralizing our teeth. So I look for that. And I also make sure that there's no emulsifiers that are kind of like soap detergents that cause like a foaming agent. If you kind of think of what happens when you're washing your hands in the wintertime and you're constantly doing that, it dries out your skin. You might even get some skin barrier integrity dysfunction.
Yeah.
And the same thing is happening in the mouth when you're using those types of detergents. So there's one that's called SLS, or sodium lauryl sulfate, that you'll find in a lot of toothpaste. Sodium lauryl sulfate, per one of my colleagues, is actually used as a standard of toxicology tests, because it's been established that it's toxic to fibroblasts, which is what our gums are typically made out of. So those are two things.
Do you have a brand?
I have a couple of brands. I really like Wellness. Out of all of the different ones that I have tried, I feel like Wellness toothpaste is the best. And part of that is Katie Wells is very meticulous about the types of ingredients that she puts in her products. And they're pretty much all natural compounds in there. And they even have environmental working group designations for the products that, or the ingredients that they put in that product. So that's my favorite one. I really like it. But there's other good ones like Risewell toothpaste is a really good one. Boca is another good hydroxyapatite toothpaste. And there are other ones out there, but those are things that I look for in a toothpaste. But really, if you are somebody that is eating a nutrient dense diet and you've got an electric toothbrush and you're flossing, water that will just bathe your teeth with this electric toothbrush is going to send all the minerals that's in the saliva throughout all the teeth, and that is sufficient. But again, I'm a dentist, and I have a better understanding than most people. So I still feel like a toothpaste is a really good option for a lot of people.
Well, Dr. Myers, really appreciate your time today. Thank you so much for joining us. And we will start booking that second podcast immediately on fluoride.
Great. Yeah, I'd love to speak more about it. I know a wealth of knowledge about it.
All right. Well, you've been listening to the Mara Labs podcast. I'm David Roberts, and John Gildea has been with me, and we really thank you for your time, Dr. Myers, and we thank you listeners for your time, because that's one thing that we all have a limited amount of. So we'll be back in next week or the week after with another episode. Thanks so much.
Thank you, guys.
All right. Bye-bye.